All right, today we're going to tackle a big one. It's a question that pops up for so many people when they look at their lab reports. Which foods can actually help lower your creatinine? We're going to break down a complete dietary guide for your kidney health. So let's get right into it.
So you get that lab report, you scan down the page, and there it is. That creatinine number is flagged as high. I know, it's a moment that can be really worrying, right? It just opens up a flood of questions about your kidney health. Well, you've come to the right place. We're going to clear things up and talk about what you can do, starting with what's on your plate.
So, let's break it down. What is creatine anyway? Well, think of it as a totally normal waste product. Your muscles make it every day just by doing their job. And your kidneys, they're like this amazing, super efficient filter, and their main gig is to grab this waste and get it out of your blood. So when that number on your report starts to creep up, it's basically a heads up, a sign that maybe the filter isn't clearing things out quite as well as it should be.
And that is exactly where your diet comes in. It is so crucial here. Look, this isn't just about eating healthy in some general sense. When it comes to your kidneys, the food you eat plays two very specific, super powerful roles in managing your creatinine levels.
Okay, so how does this actually work? It's a two-part strategy, and it's actually pretty brilliant. First up, less waste in. This one's super direct. Some foods, especially cooked red meat, literally have creatine in them already, which becomes creatinine. So if you eat less of that, boom, you're putting less of the stuff into your body to begin with. Makes sense, right? Then there's part two. Less work for the filter. This is all about giving your kidneys a break. They have to work really hard to filter out minerals like potassium and phosphorus, so by eating less of those, you're easing their overall workload.
And check this out. This isn't just a theory. We're talking about a real, measurable impact. Get this, just one meal with red meat can temporarily bump up your creatinine by as much as 0.3 milligrams per deciliter. That's a noticeable jump from a single plate of food. It just goes to show how powerful that less waste in idea really is.
All right, enough with the don'ts for a minute. Let's flip the script and talk about the do's. This is the fun part, the yes list. These are the foods you can welcome into your kitchen to really support your kidneys.
Kicking things off with an absolute superstar, especially in the Indian kitchen, Laki, also known as bottle gourd. I mean, this stuff is basically the ultimate hydrator. It's around 96% water and has super low potassium. That means it's incredibly gentle on your kidneys, making it a top-tier, safe choice for pretty much anyone.
Okay, let's talk protein. You know, this can be a real challenge for kidney patients. But guess what? Egg whites are pretty much the perfect solution. They give you that amazing, high-quality protein your body absolutely needs, but, and this is key, without all the phosphorus you'd get from the yolk or from meat and dairy. It's like getting all the benefits with none of the downside, a total win-win.
Craving some flavor and color on your plate? Look no further than red bell peppers. They're not just delicious, they're low in potassium and absolutely loaded with antioxidants. And why does that matter? Well, those antioxidants are like little bodyguards for your kidneys, helping to fight off something called oxidative stress, so you get amazing flavor and protection.
Okay, I've got another secret weapon for you, and this one is a real gem from the Indian kitchen, ash gourd, or petha. This thing is an absolute hydration hero. We're talking almost 98% water. Plus, its potassium and phosphorus levels are practically non-existent. It's just a fantastic, gentle, and seriously underrated food for kidney health.
All right, we've talked about the yes foods. Now we've got to cover the other side of the coin, which is just as critical. Let's dive into the no list, the foods you really need to be careful with to keep your kidneys safe.
So the most important thing here isn't just what to avoid, but why. Let's run through it. Red meat? It's full of creatine, which your body turns right into the creatinine we're trying to lower. Pretty straightforward. Bananas and oranges? Delicious, but they are packed with potassium, which can build up to risky levels. Dairy, like milk and paneer, that's a phosphorus bomb, and too much phosphorus is really bad news for kidneys. And of course, packaged and processed foods, they're just loaded with sodium, which jacks up your blood pressure and makes your kidneys work way too hard.
Okay, so knowing the yes and no lists is a huge first step, but we can go even deeper. It's not just what you eat, but how you prepare it. Let's get into some next-level strategies that can make a massive difference.
This next one is a game-changing kitchen hack, especially if you love vegetables like potatoes or yams that are normally high in potassium. It's called leaching. It's a simple process. You peel and chop them up small, soak them in warm water for a couple hours, and then, this is the most important part, you toss that soaking water out.
Then, you boil them in fresh water. Just by doing that, you can slash the potassium content by 30 to 50%. It makes so many more foods much safer to enjoy.
Okay, I really need you to listen closely to this next point because it is absolutely critical, potentially life-saving. Hydration is not one-size-fits-all when it comes to kidney health. In the early stages, drinking lots of water like 2 to 3 liters is great. It helps flush everything out. But, and this is a huge but, in the later stages, the kidneys often can't process all that fluid. Drinking too much water can actually become dangerous. This is non-negotiable. You have to follow your doctor's specific guidance on how much to drink.
And let's just put this in big, bold letters for a second. Your diet is an incredibly powerful tool. It can help slow things down, it can make you feel better, it can support your overall health. But, and I mean this, it is not a cure. It's a support system that works with the medical treatment from your doctor, not instead of it. That partnership is everything. So, we've gone through the what to eat, the why, and even the how. It all points to one really clear, really important next step for you. Look, what you eat is one of the most powerful tools you have in your hands. It's something you can actually control. We've laid out the groundwork for you here. So now the big question is, are you ready to take all this knowledge, partner with your nephrologist or a renal dietitian, and build a truly personalized plan that's made just for you?